All right, hey, hello everybody. Long time no talk, long time no talk, I know. So today is February 25th. Time is 10:30 p.m. I got off work at 7 p.m. Got my baby and me settled for bed. And I am here to tell you all the biggest nursing mistake that I have made so far that actually happened today. Okay, all right, so so first of all, my residents today, they had a fight. Two residents had a fight, so that sparked the DON's attention. So the DON had to come back there to the Alzheimer's unit. I work on the Alzheimer's floor. The DON had to come to the Alzheimer's unit, right? And so I guess she was going back looking at nurses' notes or something, and she came across one of my notes about a narcotic. So on February 20th, one of my patients, he had to get some Ativan. He has some Ativan and he takes PO, but it's like he knows what it is, like he knows when he trying to like give him something. So he refused it. Okay, he refused it the 20th and the 21st. So since he refused the PO med, I had to give it to him by injection. Okay, so on the chart on the MAR, it has a side where it says you administer medication, and then the side where it says don't administer medication. So on the MAR, it has like two different medicines, right? An Ativan and an Ativan. So I don't know what happened, like with the chart or with the MAR, or like why it got confused, but it wouldn't sign the medications out. And you know, whenever you're late on something, it pops up red, and the next you can see it, the next you can see it. So I couldn't sign it off. So like 2 days had went by, or maybe like a day. I tried to give him the other Ativan, as I stated earlier, PO. He was acting up again that day. He would not take it. So guess what? I just stopped trying to give him the PO Ativan altogether, because I didn't want them to think that I was messing with narcotics, because I'm not messing with their narcotics at all. My patients are, they're Alzheimer's patients. You never know what they're gonna do. So okay, so in order for me to sign it out from the day before, I had to like press it that like I administered it, but I didn't administer it, but I had to press it that I administered it. So I did end up fixing it later though. The lady from MD's office, she came, she told me I fixed it, and I, you know, made it so that it's like he never took it. But I still had a nurse's note on it, and you know those nurse's notes don't ever disappear. So remember I told you that I gave that patient a shot, right? So it was 2 milligrams per 1 milliliter vial, and he was only supposed to get 1 milliliter of Ativan. So so all I had to give was 0.5 milliliters, right? So my biggest mistake, y'all, I'm telling y'all this so y'all won't do it, so y'all won't go through the stuff that I went through. Now we all know that if you don't use the medication, that you're supposed to destroy it, and I know this. But like for PO medications, like if it's their medications, like I destroy it always, like I always destroy it. And but this medication, we didn't have any like on the cart, and so we just got it at the Cubics. The Cubics is like the place in the building where they store like all important narcotics, medications, and all that stuff. So they in my facility, they always say that getting medicine at the Cubics is 3 times higher. Okay, so I had that in my mind. Okay, so 0.5 milliliters, gave that. Only 0.5 milliliters left, right? So what did my dumb self do? My dumb self left it in the cart, but I did leave it in the narcotic box. So I was smart enough to put it in the narcotic box, duh. But I wasn't smart enough to date the medication and like put in a piece of paper in the narcotic book for it. So that was like, what, 5 days ago, because I said on the 20th. So the DON comes back and she notes that, and she was like, well, how much did you give? I said 0.5 milliliters. So she said, so there's still 0.5 milliliters left. I'm like, yeah. She said, okay, and that's a big no-no. You're supposed to waste whatever you don't give. And the reason that I didn't waste the medication was because like I said, they always told me that medication was 3 times higher in the cubics. So in my head, I guess what I was thinking at the time was, okay, since it's 3 times higher to get out the cubics, why don't I just keep it on the cart, keep it in the narcotic box, save it so that whenever he needs it again, which is probably soon, we won't have to get it out the narcotic box, the cubics. We can, you know, save money. So my dumb self was trying to help the facility save money, but I ended up messing myself up. Okay, I messed myself up because guess what, now we have to figure out where that 0.5 milliliters of narcotics went. And it's with 4 nurses that works the cart. Yeah, 4 nurses that work the cart. 2 of them have already said they have nothing to do with it, so it's only 1 left. And honestly, they probably are not going to confess to what they did to it. So guess what I have to do tomorrow? Tomorrow we have to investigate. Tomorrow I gotta get drug tested, which is fine. I know I'm gonna pass the drug test. I don't do drugs, but it's just the fact that, wow, like I might get written up. Like, how could you be so dumb? All you had to do, Ty, all you had to do was put in a sheet of paper, but you didn't. Like, it never crossed my mind. So yeah, y'all, that is where I'm at in life currently. But I'm done stressing about it. I gave it to God. I know I didn't do anything with it. I know that it was there when I left it, at least. Yeah, so I don't know what happened to the medication, but I know it's not gonna show up in my system. I'm probably gonna get wrote up, and I can accept that. But my license won't get taken away because I did drugs. So, but yes, so tomorrow I will give you all the story, the rundown, what happened tomorrow, whether I got wrote up or not, or yeah. All right, y'all, I will see y'all tomorrow.